I don't really have anybody to help me. I'm pretty much by myself. I have my cat. Her name's CJ. She's about the only company I actually have. Well, I knew I had blood clots because I've had them before. I don't have transportation to get places. I couldn't walk. I could barely get across the street to the grocery store. And once the pain got so bad I couldn't stand it anymore, I called 911.
So that's where I came in. Helen Dalton is a client of mine. Hey Helen, how are you?
Hi.
Hey, can I come in? Wanted to bring you over a couple of things. So I knew that she struggled with some issues with addiction and vascular issues. So a lot of times a patient will keep coming back to the ER. One of my jobs is to reduce the back and forth. She feels a lot of times, overwhelmed. I believe there's a lot of unmanageability in her life, and that has had an impact on her health, and she could really use the support.
There's a lot of value that the Community Health Advocate program brings. One is our community health workers see a dramatic reduction in readmissions back to our hospital facility.
Some of the reasons why individuals continue to come back to the emergency room are they may not be taking their medications, they may not have transportation for follow-up doctor appointments, so they can in turn get sicker. They may not have support, they may live by themselves, they may be homeless. There's a ton of reasons.
Community health advocates are placed in our emergency departments and our inpatient environments. They receive referrals from our case management and social work teams. Once they receive a referral, there's an initial assessment that's completed. It's about a 20-question survey that goes over categories of food insecurity, housing insecurity, utility assistance, whether you have reliable transportation to access medical appointments. Once the assessment is completed, that gives the community health advocate more information or an assessment in order to figure out what resources and services they need to connect the patient to.
Come on, girl. I went through a week of abdominal pain. I thought I had the flu. Come on, girl. And it got unbearable, so I called 911. And so the ambulance brought me to Good Samaritan Hospital. They found out I had blood clots in my abdomen that was obstructing blood flow to my small intestine. No matter what I've done, I've always been overweight, and now we're finding out the culprit is my thyroid. In order to get to an endocrinologist, I need a primary care physician who gives me that recommendation, and I'm hoping to get that recommendation today. Paul and Sherry and the Advocacy program set up for an Uber for me to go to my doctor's. Uber will come and pick me up, take me there, and then take me home afterwards.
How you doing, Mr. Rainey?
Hi, Paul.
Good to see you.
Good to see you. I didn't know how I was going to get there, and they set things up for me.
Hey, my name's Dr. Sharma, one of the medical doctors.
Okay.
Welcome to our practice.
It's hard, it's humbling, because I've had a lifetime of being able to do what I need to do to make a living, and now I can't do any of it.
And how are you feeling right now?
I'm feeling good. I'm taking time to get my strength back. Paul and Sherry came in and they helped us with Social Security so I could apply for disability. And they came in and they said, well, we can help you get set up on food stamps. We can get you a government phone. There's cash assistance available. They've just been really amazing. I'm really thankful.
I just feel blessed to be able to do the job and to be able to help people and give people the resources that they need.
Several different things that he's done that gave me hope. It's how they treat people. They just treat them good. They treat them like they care about them.
Make sure he's covered.
Very thankful because they stepped in and said, you need help in areas that I didn't even know I needed help in. And extended a hand of friendship and said, let's walk this path together.
They're solving the problems that medicine simply can't solve.